So I'll go ahead and kick things off here. And it's great to have the two clinicians here that have a kind of variety of and depth of experience with different biologics and spine surgery. And so this is, yeah, I'll leave this introductory slide up here for just a minute because Brandon mentioned big data and a new way of looking at things. And so I wanted to just take a minute to talk about that because this is kind of a new way. So it's a kind of a non-traditional type of study. And so we'll talk a bit just more theoretically about this type of study, this big data study, this mining of information, in this case from the Premier GPO system, and looking at billing data through the ICD codes. And ICD, if you're not familiar, is the International Classification of Diseases. So looking at billing data and trying to glean what you can about cost for different types of procedures and even about follow-up. So let's look at some of the primary analysis. So when we looked at the adjusted, again, this is adjusted, and frankly, the unadjusted wasn't much different than this, and I can tell you what those numbers are. But the adjusted mean hospital charges at that index hospitalization, so that's at that initial procedure, it was about $50,000 more in charges. Again, doesn't mean that's what the payers paid or anything, but these are ICD codes, these are billed charges. About $150,000 more for the Infuse patients. So let me throw it out, and I'll start with Dr. Stevens here. What do you make of that, or what would what would some of your hypotheses or speculation be as to why those costs would be that much different with Infuse patients?
Well, I think there's multiple factors, right? So the cost of the Infuse itself, we know that as a major driving factor in the difference. At least I would think it would be. Also the complexity of the surgery. I think, you look at my practice and the practice of several people, in my group, we typically use Infuse, for more complicated cases, more revision surgeries, pseudoarthrosis or deformity surgery. So I think both of those things work towards driving the cost higher.
Okay. And then Dr. Smith, what do you think?
Yeah. Did you control, was one of the covariates, did you look at number of levels? Because I would wonder whether maybe Infuse tended to be used in multi-level surgeries. Was that one of the?
Well, it turned out that Infuse, that for both of them, it was about 15% of the cases were multi-level. But to answer that question, what we did do is we also did an analysis for only single level.
Right.
So this was more of an apples to apples comparison here. And what you see is where this over here is about $50,000 difference here. It's less than that, 46,000, and overall a little bit lower cost for the single level fusion. So that's one way we looked at that.
One other thing I would add too, and that difference in cost, because that cost is quite different. The BMP isn't that, it's expensive, but it's not $50,000. Is that I kind of wonder at hospitals that are pushing to drive down costs and maybe restricting the use of Infuse more may also be looking for other cost-cutting measures, such as pushing to get patients out of the hospital earlier or reducing costs elsewhere. So it's possibly a reflection of how cost efficient the hospital is too.
Right. Yeah, and so the cost efficiency of the hospital, so with that, it could be, what you're saying, it could be more correlative rather than causative, possibly.
Right, in part.
And as we were, as we kind of speculated on this, we thought of some other things. We know that like an Infuse takes a little bit longer to prep than ViviGen. That may or may not increase OR time. It depends on how what the cadence is in the OR. We do know that Infuse is often used with some sort of adjunct. It could be an allograft. It could be, again, BMAC or something else, which could increase the cost of the case. We did, and I don't have I'm not showing the data here, but it is in our manuscript, that the length of stay for the Infuse patients was 0.1 day. It was about 3.8 days on average, and the length of stay for the ViviGen patients was about 3.7. So that kind of goes against the thought that maybe they're driving the patients out sooner. 0.1 days in the hospital, that's not insignificant. So there is some level of cost. Now, what causes that? We don't, obviously we don't know. So there's a number of things that we wondered about there, but really it's kind of speculation. But we just collectively kind of gave a laundry list of what the differences might be attributable to.
And another thing to consider too is that BMP gets marked up by hospitals considerably. The Infuse does, and so maybe more of that is actually related to the Infuse charges than we appreciate. These are charges, not collections. So.
I would bet too that the Infuse group had significantly, I mean, if I was going to guess, significantly more anterior posterior surgeries, right? Because surgeons have a lot lower threshold to use Infuse in an ALIF, say either an on-label ALIF cage or otherwise. So there might have been a difference there, driving the cost difference as well. There's a lot of those, some of those surgeries will also be staged and have 2 trips to the OR.
All right, thank you. So yeah, the summary is we know that the costs were a lot less, and we just talked about a number of reasons, possible reasons. So secondary analysis, we did look at the incidence of subsequent lumbar surgery. So this is if the patients had any lumbar surgery in the following year. So that was the in that 12-month follow-up period. So here what you see is for the ViviGen group, it's 9.46% had a subsequent lumbar spine fusion, and then about 8.67% in the Infuse group. Not statistically significant. There is a difference there, but it's not statistically significant. Now, if you remember, we talked about the single level as a subset. And if you look here, for example, the number of ViviGen patients is about 6588. And if we go to single level, it's about 5,700. So again, 85% or so of the patients were single level. And that's the same as the Infuse group. So here you have a more direct comparison between the two. So here you see, obviously, it drops down a lot because it's a single level. But here you see the relative rates of subsequent lumbar spine fusion surgery for ViviGen, and now that does reach statistical significance versus the Infuse. But again, as we talked about, there are a lot of factors in here. So yeah, I want to kind of bounce it off the 2 doctors. We'll start with Dr. Stevens this time. Like, what do you think of this here? Of these data, and I can certainly go back and forth between all levels and this one as well if you want. But what are your thoughts?
I think this is one of the 2 most interesting points of this study to me. Number one being the cost data, and then this reduction or seeming reduction in, and it's important to point out this is not subsequent lumbar fusion surgery necessarily. This is all lumbar surgery. So. In the ViviGen group, there's a significantly, reduced rate of repeat trips to the operating room within a year. I think it's interesting. It's hard to draw definitive conclusions from that, but it certainly, it raises the question of, are these patients getting taken back for things like BMP seromas? Obviously we lack the granularity to tell sort of what the real difference is driven by, but it's an interesting finding to me.
Okay, great. And then Dr. Smith?
Yeah, I think as we touched on earlier, that these data at 2 or 3 years would be even more interesting, because the subsequent lumbar surgeries within a year are going to be a lot of washouts for infection or maybe implant issues. Potentially not related to pseudoarthrosis. Pretty early for pseudoarthrosis to be manifesting and needing revision surgery. So I think 2-year follow-up or 3-year data would be even more enlightening. But at least it's suggesting that ViviGen isn't associated with more lumbar surgery within the first year. It's probably comparable to Infuse. If not, maybe a little less.